Here at Everywaywoman, we talk about everything, including taboo health topics. Today, Dr. Sherry Thomas is here to give us the 411 on fibroids. Dr. Sherry, thank you for joining us.
Thank you for inviting me.
What are fibroids?
Well, fibroids are, unfortunately, a very common process that occur about 75% of women, where fibrous cells in the uterus is where the baby grows for 9 months. These fibrous cells just get out of control and grow very large. I'm talking about the size of not just a grapefruit, but 5, 6, 7 week pregnancy.
Wow.
So your pelvis, your abdomen looks like you are pregnant, but in fact, you just have some fibroids.
Now, this is intimate to me because I had a hysterectomy because I had a fibroid that was the size of like a 5-month fetus. So my stomach was out to here. So I'm very familiar with it, but what causes fibroids?
Well, fibroids are genetically predetermined. If your mother had fibroids, your older sister, your aunts, you're probably going to have fibroids. They're also more common in different races. African Americans, about 90% of women have fibroids. Caucasian women, more like 75%.
Is that attached to anything, Jeanette? Is it food or?
We don't know. It may be a chromosome that causes the muscle cells of the fiber to just get out of control and grow. And interesting, they're mostly benign, but occasionally they can become malignant. And that's why you really want to see your doctor and follow up and have them checked.
Okay, so tell me, what are some of the symptoms so a woman can know if she has fibroids? What are some of the symptoms?
Well, the symptoms are, as you had, just your stomach's growing larger. Also,
and it was large.
They can be all the way up and press up against the lungs and diaphragm and cause shortness of breath. They also push against the bladder, so you have more urgency frequency, against the bowel, so you may have problems with bowel movements or back pain. With your periods, you may have irregular, heavy bleeding to the point where you become anemic. So you can have a lot of symptoms, but many women have smaller fibroids and they don't really know they have, and their doctor just says, oh, I feel some fibroids on your exam, and send you for an ultrasound. And in fact, you have these fibroids that they follow over time.
Okay, so when we talk about pain, how does a woman differentiate between fibroid pain and menstrual cramps? Because if you're not familiar, you don't necessarily know which one is. How do you do that?
Well, menstrual cramps usually occur during your period, but fibroid pain, you'll have pain and pressure most of the time. Now, it'll become worse during the period, but those are the differentiating. With fibroids, you're going to always have that pain.
Now, interesting enough, when I had my fibroids, I had them before I had children, and I also had my fibroid while I was pregnant. And I thought that there was a risk to my baby. Talk about having fibroids and being pregnant.
Sure, it depends on where they're located. If the fibroids are located in the lining of the uterus, where the child's growing, it may prevent them from actually growing or actually implanting and starting to grow. So some women before becoming pregnant actually have those fibroids removed so they can become pregnant.
Right, and which was my situation because my fibroid was attached to my fundus, and so subsequently I had a miscarriage. And it's when I went to the doctor that he recognized, he said, you had an obstruction there. And so I had a myomectomy, and I was gonna ask you, what are some of the options for removing your fibroid if you find out that you have them?
Well, not all fibroids, as I said, need to be removed. We watch them to see if they grow. If they don't grow, we wait, because at menopause, a lot of times they become smaller. So if you're asymptomatic, you're not having pain, you're not having irregular periods, and you're not bleeding, there's no reason to really do anything. If they start growing and they're growing rapidly, whether they're bleeding or causing pain, they should be removed, because that's concerning. They may be cancerous.
You know, Doctor, I was thinking about a young lady that I know. She's in her early 30s, and she's having a lot of problems with her fibroids. And she went to a physician, and they will not give her a hysterectomy. How can someone be an advocate for her? Because she said, I don't even want to have children. I want it out.
Sure. So if a woman has finished childbearing, or she says, I've had women in their 20s saying, I just don't want to have kids.
I don't want to deal with them.
Right, and I'm having severe pain, either endometriosis, fibroids, whatever. There are some medications we can use that actually stop the growth, and that's a medicine that stops the production of estrogen. And then ultimately, a hysterectomy or removing the fibroids if it's just 1 or 2 large ones. But if a woman's finished having children and has several fibroids that are causing issues, it's probably better to remove the uterus, because it turns out once you remove the fibroid, 50% of the chance they grow back. So why go through 2 procedures if you really know what you want?
Which is interesting for my story because, again, before I had children, I had a fibroid. Then I had them removed. Then while I was pregnant, I had more fibroids. And then finally, I just said, take it. I don't want my uterus anymore because I was starting to have those problems. So I would encourage, women out there to really go to their doctors and get that looked at, because there's so many wonderful options out there now for women that they don't have to deal with this pain anymore.
Oh, absolutely. But as you said, it's so important to have that communication with your
Right.
physician, because if you tell me, I'm 25, but I have huge fibroids and I just don't want to have kids, yes, why go through both procedures? I couldn't agree more with you.
Thank you, Dr. Thomas.
Thank you for
Before
having
you
me.
can take care of others, you have to take care of yourself. Stay tuned to Every Way Woman. We will be right back.